New daily COVID-19 infections are on an upward trend. Almost 3,000 cases were recorded in the past 24 hours.
Well, of course, the Eastern Cape is leading that surge. It was there that the Health Minister, Dr. Zweli Mkhize, received a not-so-warm welcome from healthcare workers frustrated with salaries and working conditions. But the Minister is now promising more beds and doctors for the province. Minister Zweli Mkhize joins us now from Cape Town to have a conversation. Minister, thank you so much for your time and a warm good morning to you. I mean, I understand that you made a visit to Livingstone Hospital. You also made, a visit there as part of the mass testing campaign at the Nelson Mandela Metro and the Sarah Baartman Metro. I mean, how did that go in terms of your visit there? Was it effective?
Yes, I certainly think it was effective, and good morning to you and all the viewers. We made the visit following on all the reports that we've been receiving. We receive daily reports and we look at the trends in terms of the movement of numbers. And we felt that now we needed to be on the ground to be able to see how to assist in supporting the province in containing the situation. And so we visited a number of hospitals and spoke to a lot of people there to understand the problem. Certainly, we are concerned.
And Jane here, good morning, Minister. I know that you've said before, no PPE, no work. I mean, we've got some of the worst performing hospitals in the country when it comes to dealing with COVID in the Eastern Cape. What sort of timeline are we looking at here to address these concerns?
Well, the issues of the PPEs from where I sit are being handled on a daily basis now at a facility level. We have actually set up the occupational health and safety committees, which involve the members of unions and staff and management, so that the issue around PPE should not be a discussion. It should be, there's a shortage here as seen by staff, and therefore there must be a provision, and that if there's any issue, those matters need to be resolved on the spot. So we don't expect them to be a problem, and certainly in our discussion they were not the main problem this time around. And so we do want to emphasize the fact that protection of our health workers is paramount, and so we said no PPE, no work. The challenges are somewhere else, if I may just say. The main issues that we've certainly seen the numbers increasing, and the increasing numbers are real, it's not a perception, and because of that, now the whole province is beginning to feel the strain, but in particular the area of Nelson Mandela.
Yeah, and particularly when we talk about, this surge in Port Elizabeth, I think it can also be alluded to, I don't know if we should call it a pandemic fatigue, whereby it seems people are just being a bit more complacent in terms of being, adhering to those measures still, Minister. But I want to also focus on hospitals. I mean, you raised concerns around staff exhaustion, around, your interaction with hospitals, saying that there are more alcohol-related injuries that are seen in hospitals. What is your plan in terms of curbing this?
Well, we have to do a lot of work to support our health workers. Fatigue is actually something that we understand is a real issue. It starts from the issue of the concerns around the fear of getting infection and also fear of infecting your loved ones. And it goes on to tension about ability to cope with the management of the patient, and the fact that most of the time our health workers have to be the main support around one individual. From one point there is no family, and from the other point they are sick, they need relief and so on. So we understand that, and so some measures to emphasize on psychological support have been put in place, but also we have asked that they must do reorganization of work so that people must have time to be able to take breaks and that kind of thing. So that area has to be given attention. In terms of bed numbers, the whole province has not run out of beds, but the distribution of beds tends to be a problem sometimes. In other words, you get a hospital where you get an outbreak where the hospitals are smaller, then they fill up those beds, but you've got nearby hospitals. So what's important is to be able to shift patients around so that they can go to where there are beds which are available. In terms of numbers of beds, we have seen new beds being commissioned. I went to Doranginza, I went to Livingstone. Some of the areas that were not ready in July when I was there, in fact, now are ready. So they've opened up new additional beds, they've taken up new staff, so the pressure can be seen. We've also mobilized additional reinforcement from the doctors. We've asked from some of the Cuban doctors to come over into the Nelson Mandela area. We've also conducted the Doctors Without Borders to also come and reinforce. And we've said that they must feel free to mobilize and move staff where there's less pressure to bring them to this particular area. So there is a lot of work that's being done at that level.
Minister, I should imagine that we have to prepare ourselves for the worst. It's Christmas season. There's going to be an increase in the uptake of alcohol, and we know that the virus does prefer hot weather. A lot of South Africans are concerned about our access to a vaccine. We know that there's definitely 2 out there. We're working on it here in South Africa. What sort of timeline do we have? Do we have the money to buy it, possibly from overseas?
Well, I think the first message has to be that our best defense against this infection is behavioral change, where we use our mask and avoid congestion and, people breathing at each other in parties which are cramped up in small places and having large gatherings and all of that. We need to actually say that we will have festivity under a new normal, and there's a new normal of distancing. So those are the issues that we need to focus on. Yes, we must talk about the vaccines, but there would be no vaccines during the festive season. So it's behavior that's going to help us to ease off. And certainly people are moving from one province to the other. This is really going to be a huge risk for all of us. On the other hand, in terms of the vaccine development, we are part of the conversations at a global level, and so are following up on the companies that have, started the processes of developing vaccines. The earliest that is expected is that probably towards the end of December there may well be conclusion on some of the trials, and therefore there might be application for registration starting from the USA. And because we're part of some of these trials, when ours are concluded, we would then be in a position to get applications for approvals of the same vaccines. Then the question of the finances, certainly there is a COVAX facility, which is a global network of all the about 180 countries who are working together on this. And we have pledged our support to that, and our Treasury is working on our procedures internally to be able to make some finances available when the time arises. So we hope that we'll be amongst those who will get the vaccines when they become available.
All right, Minister, thank you so much for your time. Minister Dr. Zweli Mkhize, Minister of the Health Department.